Okay, so hi everyone, my name is Mahika and I'm here as a representative for the Virtual Med Society, which is a student-led organization who has brought this webinar to you today. And today we bring Virtual Med Society's second webinar of this year, which is hosted by Joanne, a third-year medical student at the University of Nottingham. And the webinar is all about writing your personal statement. Now, quickly coming back to Virtual Med Society and who we are, I just want to point out some of the things that we offer as an organization. First of all, we have things like the monthly newsletter with information about universities, about medical ethics topics, things that you can discuss in your interview and in your personal statement. We also have webinars such as this one, and we have a couple of virtual doctor shadowing opportunities for students as well. We also recently started a YouTube channel where recordings of these webinars will go to so that you can go and revisit them if you don't manage to join the webinars live. So all of this information can be found on our Instagram, and you can access our content by signing up to become a member. Sometime during the webinar, I'll be posting the link to become a member and our Instagram handle so you can make sure that you are up to date with all of our events and any other updates that we have. Now, enough from me. I will be passing it on to Joanne now. Remember that during the webinar, if you have any questions at all, just pop it into the Q&A section and Joanne will be answering them at the end. Thank you, and over to you, Joanne.
Hi everyone, so like Mahika said, I'm Joanne. I'm a third-year medical student at the University of Nottingham. And just before I start, like Mahika said again, I really want today to be an interactive session, so if you have any questions, drop them in the chat and I'll come to them at the end. And I also want to preface by saying that by no means am I an expert in personal statement writing. I'm just sharing with you guys what I learned from my experience of doing my personal statement and what was successful. And just for reference, I, like everybody else, applied to 4 medical schools and I got 3 interviews and then I got 3 offers. All right, so also today, instead of focusing on like the main structure of your personal statement, I really want to focus today on how you go about writing your actual content. So when you sit down to write, when you think about what do I want to put in my personal statement and how you choose what you're going to write, I'm going to be focusing on all of that today. So starting with your introduction. Your introduction is probably the most important part of your personal statement. It's what draws the attention of the reader. And if you get asked about your personal statement in your interview, your introduction is most likely what you're going to be asked about. So I would really recommend talking about the reason you decided to do medicine in your introduction. So what led you to that point? What decisions did you make that got you to choose medicine? So before I started writing my personal statement, I had read a lot of samples online. And what I found was like the most successful ones, or the ones that I found most eye-catching, were those that had sort of a sad story involved. So it would be someone who said that they were in hospital or they had a loved one in hospital and they saw the medical team work together and that really inspired them. And in my case, and I feel like in many of your cases as well, you may not have a story like that and a story that sounds as interesting. And I feel like don't feel disheartened if you don't have a story like that that's very intriguing and catches your reader's attention like that. It doesn't mean that you won't get a good personal statement. I always feel like honesty is really appreciated. So if your reason to why you want to do medicine was kind of generic and boring, like, oh, I did medicine because I like science and I couldn't really think of anything else that I wanted to do, you really need to think about how you can form that in an honest way to make it sound interesting. So the way that I did that was, when I thought about it, I was like, well, what got me into thinking that I wanted to do medicine was one day I was watching Doctor Strange. And for those of you who don't know what Doctor Strange is, he's a Marvel superhero. And for like the first 5 minutes of his movie, he's a neurosurgeon. And I thought he was really cool and he was really rich. And so I was like, you know, I could do this medicine thing, this doctor thing. And then it was like, well, how do I write that in a personal statement without sounding like insane? And so what I said was, I actually came really full circle. That's where my thinking started, as maybe this doctor thing is a thing that I could do. But then after I did work experience and I did volunteering and I really thought about the things that I had done in my life, and the skills that I had, I came really full circle with medicine and realized that this was really something that I wanted to do. And then you'll expand about those things that you've done later in your personal statement. But I really do think that honesty is something that's really appreciated in your introductions. And when you get asked about it, if you've been 100% honest and what you're saying is coming from your heart, it really does come across well. Right. So then you go on to the body of your personal statement. So one thing you'll see on a lot of university websites is that they really want you to be talking about your work experience in your body and in your personal statement. And so I think you should be dedicating about 30 to 40% of your personal statement to the work experience that you've done. And in my case, and I think in the case of many of you, especially now because of COVID, you may not have spent that much time on work experience. So you might think to yourself, well, how do I write 30 to 40% of my personal statement and dedicate that to the work experience that you've done? But you have to realize that it's not about the bulk of things that you've done, the bulk of things that you've seen. It's about what you've learned from it and the way that you reflect on it. So try to avoid listing things that you've done. So if you were really fortunate and you got to do lots of things, you shouldn't be saying things like, well, I got to see this surgery and I got to watch this procedure and I went and I met this doctor and I did this thing and that thing, and just say it in a very surface level way. You want to be reflecting on each thing that you did, saying like, well, I did this and I learned this. And so make sure with every sentence that you write that you also talk about what you've learned and how that makes you a better doctor. So I'll just give you an example so you can understand that better. So from my personal statement, what I did. So this is an excerpt from my personal statement. Was shadowing a surgeon in the OBGYN department, I had the chance to observe a C-section. I saw the anxiety of a mother on one hand and the meticulous care of the surgeons bringing out the newborn on the other, working deftly to ensure minimal blood loss, all the while reassuring the mother and keeping her calm. I could see how a doctor's job constantly involved the ability to multitask, making calculated decisions while being compassionate and caring towards the patient and her team at all times. So in this, where I was like basically saying about this is a thing that I saw and it was really cool, but I also talked about how I've learned from it and what I appreciated from it. So if any of you are going on work experience now, or you've just finished your work experience, I would really encourage that you keep a journal of the things that you've done. And then at the end of the day, you can write to yourself, well, what did I learn from it? What were the things that you appreciated that the doctor did that you would want to emulate in your life? So for example, if your work experience involved sitting with a GP and seeing him take histories from patients, you can see like I really appreciated how the doctor was patient and he listened to all the patients and he had to be empathetic towards their situations and things like that. And so like in a way that how I did that was like I talked about like I said before, the C-sections, and then I also talk about junior doctors and how they have to be really meticulous in the work that they do. I also feel like it's really important to not just reflect on the good things that you see in hospital and like the things that are really heroic and like things that you really appreciate about the doctors, but also talk about some of the negatives that you might see in hospital. So for example, if you were sitting in a GP's office all day and you thought it was a bit boring that a lot of the time what GPs see all day is just people coming in with cold after cold after cold, and all they do is say prescribe paracetamol, or they're just prescribing cough medicine, and that can be quite mundane if it's day to day. But then also making the realization that while that for a doctor might be mundane and just every day, for the patient it makes such an impact, and medicine is the only career that you can do something like that. That's something just as simple as writing down a prescription for a patient is improving that patient's quality of life so much. So again, making the realization that not everything about being a doctor is glamorous and fun and innovative, that there are some very mundane things that you'll have to do. I just to give you an example, that was something that I wrote in my personal statement, that I had said that watching junior doctors taking notes was quite a tedious task. And they said, well, why did you say it was tedious? And I said that, you know, I realized that they have to be so careful in what they're doing, and they spend hours and hours every day writing these patient notes. And it's not going to be fun, but it's so important into the healthcare of that patient. So yeah, so it's really important that you not just talk about those good things, but also the bad things, but realizing that with those bad things, you have the ability to overcome them, and realize that that there's good and bad, and at the end of the day, the good will make up for the bad. Yeah, so then additionally, aside from the work experience, you want to talk about things like volunteering and any achievements that you've had in school. So say Duke of Edinburgh Award, Student Council, any sports that you've played, instruments and things like that. But again, like I said, with the work experience, you don't want to be listing these things out. Because your personal statement isn't a resume. It's not about, again, what you've done. It's about how you can relate that back to medicine, and how those things that you've done have given you skills that will equip you to do your medicine degree or become a doctor. Yeah, and so, yeah, so when you're editing, you want to make sure that each skill that you've talked about actually pertains to how it's going to make you a better doctor. So what I did was I kind of listed out what I had done in school. So I had listed out that I was in student council, and I did so-and-so competition, and I did Duke of Edinburgh, and I kind of ranked them in accordance to how I felt it given me a skill that would help me become a doctor. And you might find that there's a particular skill that you were very proud of that didn't really relate to medicine, and you might have to cut that out, because what they really want to see in your personal statement is how those skills have related to medicine. So I would really avoid putting a skill in that does not relate to medicine at all. So for example, what I had to cut out was I had done basketball in school a lot, but I found that for me, basketball didn't really give me skills that I felt like I could use as a doctor. Not saying that you can't talk about sports in your personal statement. If you feel like sports is something that taught you teamworking and leadership, absolutely write about it. But for me, that wasn't something that I felt like I could truly honestly say contributed to my desire to do medicine. So in that sense, I just want you to realize that there are some things that would pertain to medicine a lot more, and you need to decide what does relate and what doesn't. Right. So once you finish the body of your personal statement and you come to the proofreading stage, I would really recommend Googling the qualities of a doctor. So qualities of the doctor off the top of my head is like leadership, team working skills, empathy, being a good communicator, etc., etc. And you just want to check when you're reading your body, have you mentioned areas, either in your work experience or your volunteering or your achievements or whatever, that you have been able to learn these skills or demonstrated these skills? Because a lot of the time, again, when you're reading university admissions websites, they'll say that, does the student demonstrate such and such qualities? And a lot of the time, especially if universities consider personal statements a lot, if you've not name dropped these words, they'll say that so-and-so student has not displayed these characteristics and hence we reject them. And so they're really looking for these characteristics in your personal statement. And when you come to interview as well, you really need to be talking about, I have these characteristics, or I've shown these characteristics in the activities that I've done. So now when you're coming to your conclusion, you should really reiterate the fact that you really understand everything that comes with being a doctor. You understand that it's a really rewarding career and you're changing lives, and you get to have that impact on society, but also talk about the fact that it is difficult and that not everything is going to be easy, but you're ready to overcome these challenges, and like reiterate again that you've shown in your personal statement that you've proven that you have these qualities that allows you to overcome the challenges that a doctor faces. And that should be your conclusion, and you should be fine in that sense. My final word will be that these days, especially, I've seen that a lot of universities aren't really looking at personal statement that much. So I would say don't stress too much about your personal statement. I know that when I was writing mine, I was really, really stressed out about my personal statement. And so I mean, I put a lot of effort into it, but I realize now that actually I never got scored for any of my universities on my personal statement. So, but still, that should not stop you from writing a good personal statement. You definitely should, because it's a really good chance to show universities your qualities, and especially when you're applying as an international student and things are so competitive, you want everything to be to the highest mark as possible. So yeah, I'm just gonna have a look at the questions now. Yeah, so the person that said, do medical schools even read personal statement these days? Yeah, so I to all the 4 medical schools that I applied to, they said, some of them said we'd read your personal statement, but we won't score it. So yeah, if anything, it just shows your characteristics, and it's really not that important. But yeah, everyone still has to submit a personal statement when you're applying on UCAS. But I would say you don't have to stress too much about it. Okay, how do I begin and how can it be eye-catching? So like I said, so obviously if you have a really interesting story about how you ended up on the path to medicine, you can definitely say that. But if you don't have an interesting story, I do think, like, for example, if like for me, I really did not have an interesting story. It was like I genuinely was like, I couldn't think of anything else that I wanted to do. I liked science, so I was like, okay, I guess I'll do medicine. And then I had to really, really, really think. And that's when I thought about this Doctor Strange thing. Initially, I was like, these people are going to think I'm insane talking about Doctor Strange. But then actually, I was asked about it in my interview. And they said, no, actually, we thought it was really funny and it was really honest. And it really showed that you went from thinking that medicine was this superficial thing to really understanding that medicine is so much more than that. So I feel like even if you're just saying like, oh, my parents initially were like, oh, we really love a doctor in the family, even just saying that, honesty sometimes is the most unique thing, and that's the most eye-catching thing, as opposed to just trying to fit in the box and doing what everybody else is doing. So what are the alternatives to work experience now that we can't go to hospitals? Actually, I'm not very sure if how universities are doing the work experience part of the criteria now that people aren't allowed to go to hospitals. But I do think more than that, it's about understanding what goes on in a hospital. So just like watching documentaries, I know there's so many shows on Netflix now that are like real life documentaries on hospitals. So if you're just like saying like, I watched this documentary and I could see how hard the doctors have to work, and I saw how patient and compassionate they have to be, I feel like given these circumstances, that should be enough. And then if it's possible, like for you, you're not able to go into hospital, but if you could go into like a care home or any environment that's like caring, so maybe like volunteering for younger children in your school or volunteering in like a nursery or something like that, I feel like that would be good. Let's see. How do I choose what is the most important activity? I feel like honestly, it depends on you. Like, think about for you, what was the thing that you're most proud of? For me, I really want to talk about student council because I spend so much time giving like my effort to student council, and I felt like I learned so many activities that related to medicine. So I feel like pick the thing that's the most related to medicine. So like, what skill did you learn the most that you can talk about that gave you the skills to become a doctor, and that would be your most important activity? Does it have to be written in a flowery language with strong vocab, as I'm not really good at that and can't express myself in a complex way? No, honestly, I'm not very good at flowery language either. I don't really think they care about flowery language. I feel like just make the point of like what you're saying, and just like write like, okay, I did this and this, and then this is how I learned from it. And they're really not looking at flowery language. It's not an English assessment by any means. They're just looking at the points that you're making. How important is it to mention one's weaknesses? I mean, I feel like mentioning your weaknesses, I didn't do that in my business statement. I feel like I can definitely see that being asked in an interview where they'd be like, well, what is your weakness and how can you overcome it? I don't know. I don't think I would personally mention my weaknesses in a personal statement. But that's just me, just because you're trying to promote yourself. And if you say like for me, I would say like, oh, I'm really scared of everything, I feel like that would just come across as kind of bad. So yeah, maybe avoid your weaknesses in the personal statement, but at the interview, definitely keep those in mind. Okay, there are a lot of questions here. I'm just trying to find the oldest ones. If you don't mind, could you please explain what your experience was through applications, interview, and year 13 in general? Yeah, okay, so year 13, if anybody is in year 13 or going to year 13 now, it was extremely stressful because medical application is a lot, as you guys will find out. I went through a lot of self-doubt. I was convinced that I was not going to get in, especially when you see like 13 places, 12 places, 20 places. You think to yourself, like, how am I supposed to get so few places? As an international student, I mean. And so I think like don't doubt yourself so much and just be motivated and put as much effort as you can into your interviews and your personal statement and your UKCAT and stuff. And I think you should be fine. Yeah, that's my main thing. Like I used to doubt myself so much. I didn't even think I'd get into one medical school, let alone 3. So yeah, I just say don't doubt yourself. Did you include any aspects of shadowing, for example, a biomedical scientist, to understand the procedures involved in? I didn't really get that question. Does the person that wrote that question want to expand a bit on it? Because I didn't really understand it. And I'll come back to that one later. What about for Oxbridge? How important is the personal statement? I think it would be very important because I know, obviously I didn't apply to Oxford or Cambridge, but I think it would be very important because I've heard people who've applied to Oxford and Cambridge for other courses, and I know that they just sit with your personal statement and they grill you on it. So yeah, it would be extremely important. Every word would be important. You would want to have flowery language. You would want to be as unique as possible. And especially if you're applying as an international student, it would be extremely important. What subjects did I take in A-levels? I took biology, chemistry, and math. How much time should you spend on your personal statement? So I started writing my personal statement, I think, in August of the year that I was applying. So I applied in 2019. So the application had to be sent out in October, and I started writing it in August, right after I finished my work experience, which was in July. And so what I did was like, I would just write draft after draft. I think I did like 9 drafts until I submitted it, just changing everything, and then showing it to people, and then they would criticize me and then I would change it again. So yeah, but it was definitely not like every day I was doing it. It was like, because I was doing my UKCAT alongside it. So it's just, I would say start early so you don't feel stressed. Where all did I apply? I applied to Nottingham, Cardiff, East Anglia, and Hollyoak Medical School, and I got rejected from Cardiff. Tips on cutting characters down, because my personal statement draft is above the character limit and I can't get anything removed from it. Yeah, okay, so I had this same problem, and I was talking about how I ended up removing basketball from my personal statement, and that was one of the reasons that I did it, because although I was really proud of everything that I had achieved, being in the basketball team, I'd been the captain of the basketball team as well, I just found that if I really thought about it, I was like, did basketball really affect my desire to do medicine? And the answer was no. So I feel like in that sense, when you're looking through it, just like really think about it and like think, well, did this thing actually, like, is this actually very related to medicine? Can I really talk about this in the medicine sense? And if that's not the answer, if the answer to that is not yes, then just remove it. Yeah. Am I missing any questions? What degree did you choose for your 5th choice? So I didn't actually do a 5th choice. I kind of was very risky and just applied to 4 medical schools, and that was it. So my university counselor said that if they reject you, they're likely to give you like an alternative degree instead. So for example, when I got rejected from Cardiff, I think they offered me a place for medicinal physics or something. Not that I would have taken it, but they do that. But I know that a lot of people do a biomedical science as their fifth choice. One of my friends did biomedical science at UCL as her fifth choice. I saw another question come up, but I can't see it. Oh, okay, there we go. I see it now. Give me a second. How did you manage your UCAT prep and all of the things at the same time? So I did my UCAT in the summer. And because I was not doing anything else in the summer, I was just able to dedicate all that time to UCAT. I would really recommend doing your UCAT before you go back to school. Otherwise, it just gets too busy. You really want to be focusing on your exam grades once you go back to school. I would really, really, really recommend finishing everything for your application before you go back to school. So finish your personal statement, finish your UCAT, so that when you go back to school, you're only focusing on your grades. So yeah. Are there any other questions? Is there that initial question that I skipped? I'm trying to see it now, but I can't see it anymore. Can someone help me out? If you wanna, I don't know if everybody's on this, if you can unmute yourself and say it, but I don't know if you can do that.
Joanne, I think there's another question on the Q&A, just one last one. I think it says, did you take the BMAT?
Okay, no, I did not take the BMAT. I was honestly lazy, that's why. I was like, well, I can just do the UKCAT. The main reason I didn't do the BMAT actually is because the BMAT results come out off the deadline for the application. So I was really afraid that if I did really terribly on the BMAT, then I've wasted a spot on my application. So no, because of that, I didn't do the BMAT. Would I recommend Nottingham for medicine? Yes, I would. I definitely would. Yeah, a lot of universities these days do PBL, and I really realized that PBL was not for me, and so Nottingham does not do PBL. For those of you who don't know what PBL is problem-based learning, and so in PBL you learn in like small groups, and it's like you learn off of each other, and it's quite independent learning. And Nottingham is one of the, like, these days not that many universities don't do PBL, and Nottingham doesn't do PBL, and I'm really glad that I didn't do PBL. I just realized that it was not for me. I'm not someone that talks a lot in class if I don't know what I like, especially if I'm learning something new. I like to sit and listen. I'm not someone that likes to talk and maybe like not know what I'm saying and be stupid. I like to sit and like listen to what everybody else has to say. And with Nottingham, it's more lecture based. So they kind of spoon feed you everything. I really like that because going from school to medicine is a huge jump. And the way that they teach you in Nottingham, especially in first and second year, is that they give you everything that you need to know. So you don't have to like do your own research and stuff. And so it's very straightforward and you can adjust to it really quickly. I find that when you have to like change the way that you learn completely like that, it can be, I don't know, very overwhelming and you might struggle. But no, if you're someone that likes to interact a lot in class and I don't know, likes teamworking and talking like that, then obviously like PBL is for you. But if not, then highly recommend Nottingham. Also, we have dissections, full body dissections that most universities don't have, and I would really recommend dissections if any university you do that, but Nottingham does that as well. What were your expectations from parents in supporting you? So I suppose you mean like financially supporting me? So my parents fully financially support me. I would never be able to afford medical school on my own. So yeah, but like just generally in life, they support me a lot. Yeah. Is there anything else that you guys have?
Joanne, I think there's a couple of questions in the Q&A section. If you can't find that, I can.
Oh, okay, yeah, I think I found it.
Yeah.
Okay, which unis are friendly to international students from different cultures and religions? I feel like it's really hard to say because I mean you could pick unis based on regions that are very international, but then at the same time you can't guarantee that that region will have people from that area. So like for example, Birmingham is a very international area, but you couldn't guarantee that the people who come to Birmingham to study would be very international. I'd say just generally medicine tends to be a very international course. Um, but yeah, I do feel like, especially because medicine has so few international students that they allow on the course, it tends to be majoritively local students, so it's not that diverse. Nottingham is pretty diverse, I'd say. I'd say we're about 40% people of color and 60% white. But everyone is very accepting, so you don't have to worry about like racism or anything like that. What was your first year experience like? So first year, I think just generally for university can be very overwhelming when you're coming like from a new country and there's like culture shock and things like that. Yeah, initially I think I'd say like 2 months after going, I did feel quite homesick and I was like ready to come back home. But I feel like first term is just quite hard. Once you get back into second term, I really enjoyed it. I had so much fun. And I was so sad when COVID hit and everything had to stop. Um, in terms of how it was study-wise, I really struggled in the first term of medical school. I just did not understand how we had to study. I didn't know the level of detail that you had to study. And so I remember like my first test that we did, I really messed up because I didn't realize we had to study as much as we did. And then I changed the way I studied completely. And now I'm like back on track and I'm like, okay, I've understood how to study. And you really need to be working hard consistently every day. And once you find that balance, then you'll be fine. How do we know which unis are PBL? On most universities' websites, they'll say like the way that we teach, and they'll say like, okay, we teach based on problem-based learning, and like it's like the first thing that comes up that they like advertise. I think how much should your UKCAT scores impact UCAT? I'm saying UKCAT because when I did it, it was called the UKCAT. How much do your UCAT scores impact your application in comparison to your high school grades? So, well, I think it depended on which university was looking at it. When I got my UCAT score, it was just slightly above average. So I think I was in the 70th percentile when I applied. So it was just above average, I'd say. And so as I think as an international student, it wasn't that competitive of a score. So I wanted to stay away from all the universities that really looked at UKCAT. And so I chose universities that looked at everything in kind of a balanced sense. So like it was like equally grades, equally UCAT, equally personal statement, and stuff like that. There are also universities that look at situational judgment a lot more than, well, they give situational judgment a lot of preference. And I had done well on my situational judgment. I'd got a band 1, so I looked at universities that would give me credit for that. And so yeah, so you really have to tailor your university choices to which one will give you the most credit for the things that you've done well. So yeah. The personal statement has to be 4,000 characters. Is that with or without spaces? Oh, I'm not actually sure. I know that when you go into Word, there's like a button that you can press that shows you how many characters it is, and that needs to be 4,000, because that's what I did. I think you'd have to Google that. I'm not very sure, to be honest. Is dissection really useful or prosection? Honestly, I think dissection is so useful because like when I remember things, I remember the way that we did it, the way that we cut it, like because we are like there are 3 of us for a body. This year we had 3 of us to a body, and it was like I remember we cut open the chest, and then we opened the chest, and then we spread the ribs, and then I saw the lung like this, and then I took out the lung, and then I took out the heart, and that's really good for you to remember like the layers of things. Whereas with the prosection, it's kind of all there already. And so you don't really get that feel of like hands-on how to do it. There's this thing of like when you do it with yourself, when you're doing it with your own hands, you're able to remember things better. So in that sense, I feel like dissection is really useful, but obviously like cross-section is good. But yeah, there's nothing like dissection. It's really cool. What all did you do for your UCAT preparation, and how much do you think it is necessary to get into medical school? UCAT is really, really important for medical school. It's kind of annoyingly important. There are some universities that do like 70% of their like your score that they give you to enter university is from UCAT. So yeah, it is very important. Most universities will look at it a lot. So what did I do? I got this membership on this website called Medify, I think it was called. And I only got a 2-week membership because I found out about it really late. But I did that very intensively for 2 weeks. And then I also got a book. Oh no, actually I don't have the book anymore. It was like a book that has 2,500 UCAT questions. The book was not that helpful. I feel like if you are practicing for the UCAT, use online websites because they will time you. And also you really need to get the feel of doing it on a computer, because I found that that's quite hard, staring at a screen for 2 hours. So yeah, really practice on the computer and avoid using textbooks. Oh, how much did I score in the UKCAT? So I scored 2,600 and I got a band 1 in situational judgment. But yeah, mind you, the UKCAT scores, they vary year to year. So some years a lower score will be better and some years a higher score is like not as good, because it's like how grade boundaries work and it changes every year. Some years the paper is harder than other years, and I think the year that I did it was quite hard. But yeah, just letting you know, the most important thing is your percentile that year. And you'll find out the percentile in October, so you won't know it immediately. So just before you apply, you'll find out your percentile, and based on your percentile, you can choose which university you want to go to according to how well you've done. There are a lot of questions now. Give me a second. How do you feel about med school after studying physics, chem, bio in school? Also, is there a particular field you're interested in medicine? I really like medical school. So when I was applying, I wasn't actually very convinced that I wanted to do medicine, because everybody kept saying medicine is so hard, you want to quit and stuff. But when I came to university, I was like, yeah, it's difficult. It's not easy, but it's doable. I'm not like dead or anything. It's fine, and I still have free time and stuff, and I really enjoy what I'm studying. And yeah, I love biology and I love learning about the body and stuff. There is no physics and chemistry in biology. I've not touched physics in medical school. We did a little bit of chemistry in like the first term of first year, but then after that, I never did any chemistry after that. And is there any particular field that I'm interested in? The field that I'm interested in changes like every week. Like a couple months ago, I was like, I really want to be an endocrinologist. And then I was like, no, I want to be a neurologist. And then I was like, no, actually, I like everything. I think I'm going to be a GP, or I'm going to do emergency medicine. So it changes all the time. Do you always have an idea? Do you always have an idea of which field of medicine you would want to work in, or just figure it out in med school? Yeah, like I said before, I don't know. And also, you don't have to make a decision of what field you want to do until not even like after you graduate medical school. You do your foundation years, which is when you're studying you're working as a doctor. And even then, it's like you have to do everything. You can't choose a field. So I only have to decide now what field I want to do after 5 years. So yeah, you have plenty of time to decide what you want to do. How useful is an iPad to make notes? Is it useful during placements, or maybe we can just use a notepad? I think it's really useful. So I don't have an iPad, I have a Surface. So it's like something like an iPad where you can make notes. It's really good for anatomy and stuff, because labeling things, if you just have a laptop, it's so hard to learn anatomy. You really want to be able to label things. I've not started placement yet, so I can't tell you whether I've used it on placement. I don't think you'd use it on placement. You would just take a notepad around because it'd be quite heavy to carry around an iPad with you. But when you're studying on placement, so like when you're going between hospital and hospital, you'd want to take something light with you, so like your iPad or whatever. And then being able to write notes like that is very useful. Also, yeah, one of the other reasons is like, for example, in the last exam that I just did, we had to like do drug charts and we had to write it out by hand. And I got to do that just on my laptop, like my Surface. And yeah, it's very helpful in that sense. I'm just trying to find questions. Which study methods do you feel are the most helpful in med school? I feel like it really depends on you. I feel like some people are really into flashcards. I just recently got into flashcards, but I still feel like I'm only half into flashcards and not into it. I feel like I'm a very, like, I have to handwrite stuff, but I handwrite it on my Surface. And so in that sense, like, that's how I'm able to do it. But it really depends person to person. So many people do so many different things. And once you get to medical school, you'll figure out what works best for you. Will you be able to balance studies and hobbies in uni? Yes, definitely. I kind of, at least for me, because I consistently work every day because I really hate leaving stuff for the last minute. I usually am done studying by around 4 o'clock in the afternoon, and then I have the rest of the evening to go do stuff. I go rock climbing, I go for like Zumba classes, I go for walks with my friends, I go out with my friends and stuff like that. There's plenty of time, you don't have to worry. When are the interview offers expected? Usually around November time, they start coming out. Mine came out around mid-November, but it really varies person to person. Sometimes they'll make you wait ages. And again, university to university, it really varies. So yeah, I really couldn't say for exact, but I know that they start coming out in November. How to estimate the proportion of medical work experience volunteering achievements to the extra. Yeah, so I wasn't going to read the whole question, but yeah, I'd say that it really depends on like the balance of things. So like if you've done a lot of work experience and a lot of volunteering and you want to talk about more of that, then go for it. About personal interests, like I feel like if your personal interests don't relate to medicine, you don't really need to talk about it. So like if I was to say like, oh, I actually really like reading, but my reading has nothing to do with medicine. I read for fun, I read fantasy, and it has absolutely nothing to do with medicine. I would say don't put that in your personal statement. I feel like that's probably something you can talk more about in the interview stage if it comes to that. But otherwise, if it doesn't relate to medicine, don't talk about it. So yeah. Yeah. Is there anything else?
Well, thank you very, very much, Joanne. I think that was really, really helpful. Like I personally got so much out of it and I was like sitting making notes. It was really helpful. Thank you. So if anyone does have any more questions, I think you can just send us an email or you can DM us on Instagram and Joanne, if that's okay, I can like send them over to you and you can like answer them for us.
That's totally fine.
All right, so thank you so much, Joanne. If anyone would like to revisit this webinar, then we have recorded it and we'll be uploading it onto the YouTube channel and we'll let you know once that's up. That's it. Thank you so much, Joanne. Have a nice day, everyone, and thank you for joining.
Thank you, everyone.